I'm Dr. Rajiv Singhal, founding member, managing director and group CEO of Meringo Asia Healthcare. COVID-19 was a event which actually shook the entire healthcare system all across the world. I would actually say that it helped us in recalibrating ourselves, reevaluating ourselves, what direction we have to take to deal with the pandemic situations like this or any other emergencies which will come across the world over a period of time. The entire healthcare ecosystem, after the initial shocking phase, stood and after that fought the entire war and came out as winners. There are few elements which we should pick up from the entire learnings. One, I would divide this into is how we should ensure the supply chain mechanisms should become far more effective, far more local. Our dependence from the entire world should be minimized so that in times of crisis, when nothing is moving around, the local movement is the most suitable movement which can be relied on. That's the first part. Second was how technology played important and integral component in the times when people could not travel to the hospitals. The embracement of technology was another landmark. Whatever we could have done in next 5 years, I think got fast forwarded and people adapted technology, both the healthcare workers, the patient, the society, every individual moved towards the faster adaptation of the technology. Last but not least is the quality of healthcare. People became cognizant of the fact that the infection control mechanisms, they're delivering quality outcomes has become far more important. The entire infrastructure, the outlook towards building the infrastructure, putting processes in place has played an important role as far as setting up the new healthcare ecosystem is concerned. We are better prepared now. The ecosystem is shaping up faster and better, and I think we will be able to deal with the situation in much more agile manner. The fourth element which I would like to focus is the spirit of collaboration, the need for collaboration amongst various healthcare organizations coming together in times of pandemic. On collaboration, I would further like to put more emphasis on it. This was a time which saw various agencies, the public agencies, the private healthcare providers all came together and they were fighting for the same cause. This was a time where the trust developed between all the players and they were collaborative in their entire approach. The data was being shared, the therapies were discussed, the clinical outcomes were shared, and the entire objective was give the best benefit to the patients who should be our ultimate beneficiary in the spirit of collaborativeness. Our objective should be going forward, stay focused on this collaborative approach so that we are able to cover the length and breadth of the country to give the best healthcare to the people of this nation. I started my career with Indian Army after having graduated from the prestigious Armed Forces Medical College. I worked in Army for 14 years. I was surgeon in Army. And after leaving Army, I worked across various healthcare organizations which gave me the insight into the other part of the healthcare system, the so-called private healthcare system of this country. With this experience, having served in various organizations, both in Asia and Africa, I moved towards setting up the organization Meringo Asia Healthcare in October 2020. And at this stage, we have 3 investors, Samara Capital, Family Office of Godrej and Family Office of Havells. The entire vision of the platform is to set up a pan-India 5,000 bed network hospital over a period of time. The key differentiators and the focus areas will be the first philosophy or the glue for this will be the patient first, where all our decisions which we take in the organizations will be aimed at the benefit of the patient. The other aspect, majority of time when we talk about Indian healthcare, there are 3 A's which are very commonly used. That is affordability, accessibility and awareness. In Meringo Asia, we decided to add the 4th A, the A of accountability. We need to create the organization which can be held accountable by the people, for the people, and at the same time for the stakeholders. We need to be accountable to the employees, to the society in which we live, and to all the people who are associated with our ecosystem. Let me start by focusing on the patient first. When we are setting up this organization, the major key difference was this is a commonly used term by majority of the organizations. How do we ensure that we demonstrate it? The answer lies in very simple thing. Whatever decisions, if we have to choose for the medicine or a consumable, the first question which we'll ask, are we going to choose it for our parents or our kids? If the answer is yes, go for it. This is best for your patients. That is the way we are going to measure the patient first. A very simple scale, but still measurable and with complete transparency. Again, coming back on one more component is building the element of trust and transparency. This is the need of the hour, where patient definitely needs to know everything what is going about his treatment plan or her treatment plan. Build the system of transparent billing, build the system of accountability. Today, if the diagnosis is being said or some test is being asked for it, patient should have the faith and the belief that is in the best interest of the patient because there is a need, scientific need to get the test done, which will help us in taking a clinical decision. So that's very important for us. And we are working over time in trying to ensure that we are able to create that ecosystem at Marengo Asia Healthcare. The other aspect which I want to focus is on setting up of clinical excellence, center of clinical excellence. Wherever we have our hospitals, our objective will be in certain specialties, we should set up the regional center of excellence. It's not easy for patients to move from a city with their relatives from one city to another for the want of a therapy which does not exist in the local area. At least they should have an access to that therapy to the completion so that they are benefited and they do not have to travel from one place, leaving the job, taking the family members and moving from one place to another. The last is the concept of clinical corridor. When we are creating an ecosystem, we are saying sometimes it's not necessary for even the patient to travel from one hospital to another. Why can't, if we have a talent in one hospital, why can't we have fellow colleague, doctor from our hospital visit this hospital and also look at the patients? Today when we speak, this is the concept which we have done, where the heart transplant surgeon from Ahmedabad hospital comes here regularly to another hospital of ours in Delhi and is setting up the entire program so that people from Delhi, they do not have to travel to Ahmedabad. Similarly, we have other therapies on which we are working on similar lines to set up and strengthen the concept of clinical corridor. We have a 500-bed hospital in Ahmedabad, which is Marengo SIMS Hospital, twice JCI accredited hospital, doing excellent clinical work. They have done 30 heart transplants, which is second highest in the country in last 1 year. The other hospital, which is part of our family, is Marengo QRG Hospital in Faridabad, again 550-bed hospital, beautifully built hospital, doing good clinical work. The third hospital, which is part of our family, is hospital in Bhuj, 200-bed hospital, KK Patel Hospital, which we run as a part of our O&M. The idea is to bring the expertise to the people of Kutch in this hospital. Now going forward, by this year end or end of this financial year, we should have around 2,000 to 2,500 beds. We are looking for right assets where there is an opportunity to scale, build quality, and also ensure they are part of the concept of our clinical corridor.